Welcome back to the Coach's Corner Show, brought to you by Beggar's Pizza. If you're just joining us, we are at Athletics, Sports and Orthopedic Physical Therapy. Our guest, the man, the myth, the legend, Tom Mulvey, physical therapist, exercise physiologist. How's it going, Tom?
Good to be here. Thanks, Pat.
Thanks for coming on board again. We gave Tom on just about every year, one of our valuable sponsors, and we're going to get into a little fatigue. And you know the old saying, Tom, no pain, no gain? That's really not an accurate statement, is it?
Not anymore, no. We know more now.
Yep.
You know, and so we hopefully we're addressing it and being a little bit more specific in our training with these kids.
So let's talk about what is fatigue, Tom?
So fatigue is impaired muscular performance towards the end of a skilled activity. So this is when, you know, the layman can look and say, boy, the kid is just really not doing what they're able to do, and so their movement is starting to become impaired.
Yep. What about the role of the muscle play, Tom, and something like that? What does it impact oxygen have?
Yeah, so the idea of fatigue is actually more complex than we think about. The muscle is the main focus, because the muscle, through its ability to have oxygen transferred to it, is able to metabolize carbohydrates and fatty acids and use that for energy. So the muscle is the kind of the organ or the factor that we look to see how it impacts when this skilled activity is starting to come apart. So we look to see what are ways that we can address this in training to help make the muscle more efficient.
Okay. What impact does this have on the athlete? Obviously, we're dealing with a lot of high school athletes, college athletes, and families that watch this show. So what impact does it have on
So you'll see that the athlete is losing his ability or her ability to have proprioception. The step length, their movement is just not as efficient, and you can tell proprioception is the ability to know where your limb is in space. So it's not something that we think about, and it's through practice and through continuing to perform a skill that you are able to know where you are to be and how you are to be at certain times. Reaction time is another factor. As these players start to fatigue, as the process starts to decompose, that they just don't react as quickly as they're supposed to, and again, that's something that can create a problem as the activity continues.
So what implications does this have on the joint specifically, on protecting the joint?
A lot, because now when you see them and you're out there encouraging them and pushing them to go a little further, go a little harder, as soon as you start to see that the muscle is not functioning properly, it's a major player in the ability to maintain stability in the joint. If the muscle starts to fatigue, it puts added load on the ligaments that give knee stability. And now, obviously, we're playing with a ticking time bomb. Can they continue to push those ligaments to a point where the load exceeds the strength of the ligament? Okay.
And what is central nervous system fatigue? I've heard of this.
Right.
Explain it to our viewers.
So we know that in that joint, there are also nerves that feed into it to allow for proprioception. How does the body know where the joint is in space? You know, how do we know that we're putting our foot placement down at an appropriate point? There are nerves that are within that joint, and those nerves feed that information back into the central nervous system, back to the brain. And the more activities are performed, the more they start to occur, not necessarily going all the way to the brain, but at least back to the spinal cord. Central nervous fatigue is a point in which the pathways coming from the nerves to the muscles are just not working as efficiently as they usually do.
Okay. And how do the nerves play a role in fatigue?
So as we talked about, information is conducted through those nerves to the muscles during activity. And when you talk about activity, you know, this functions at multiple levels. This could be some of our patients that are here working on rehab, but most importantly, that the skilled athlete, he's performing a much more complicated skill. Anything that changes the efficiency of his ability or her ability to do that is going to impact the end result. And so we want to make sure that the whole system of conducting information to that muscle to allow that muscle to function at its most efficient form is maintained. And that's what we're talking about tonight.
All right, and how does the central nervous system and peripheral nervous system play a role in this, Tom?
So the peripheral nervous system are the nerves that come from the actual spinal cord out to the muscle. So information is transferred from the cord to the muscle and back to the cord, and that's peripheral. That information then goes to the brain through the central nervous system, and that's the whole network that works with that muscle to be able to allow it to function in a skilled activity.
Okay. All right, folks, we're going to go to a Lisa Thomas Salon timeout. Remember, 3 locations, Mokina, Tinley Park, Orland Park. And I have to give kudos to Lisa Thomas Salon. They had a float in the Blue Island Christmas Lights Parade last Saturday, and it was phenomenal. Brought the trailer out. It was looking good. Good time had by all. All right, folks, we come back from this break. More with Tom Mulvey from Athletics. Stay tuned.